I would say the biggest symptom would be isolation. I know sometimes as a teen and as a young adult, we want to isolate, right? And especially now we're on our phones.
It's the sign mental health experts point to the most. If you see your child start to pull away, it's time to talk.
Some warning signs, changes in their behavior. If you've got a kid who's, into a lot of activities, spend lots of time with friends, and then you begin seeing them starting to isolate, stay in their room more, that's a sign to just check that out.
Paige Gaines started 911 St. Jane as a place for young girls to get help. She understands. She tried to die by suicide the first time at 12 years old.
And coming from that space and being a Black woman, my parents and myself, we were just looking like, well, who do we even turn to have this conversation? How do we get help?
Gaines says parents need to know children express anxiety and depression differently.
I simply would say, hey, I don't feel good, right? My stomach is hurting, my headache, I have a headache right now. I really do not want to go to school. My chest hurts.
According to the Georgia Department of Health, suicide rates are down across most demographics except in the Black community.
Suicide is now the third leading cause of death among African Americans aged 10 to 24. This is the first time ever in history that suicide rates in the African American community among any age segment have superseded that of the white population.
Studies show Black Americans are less likely to seek and receive mental health care.
I grew up in a home where, it was what happens in our family stays in our family. We don't tell other people about problems that we have. And historically, I think that has been a great barrier for African Americans in seeking help.
While some issues are starting in school, the solutions to this crisis aren't making it home.
So a lot of schools are implementing the education and the conversation within their school system, but the disconnect comes when we're not bringing it home. So the parents aren't aware, the parents aren't receiving that education.
Georgia has a new 988 crisis line that the Department of Health says is working. 10% of calls in the first month reportedly came from kids under 18. You can find more of those resources on 11alive.com.